Chiropractor today, talking about frozen shoulder. Frozen shoulder means exactly that. When people come in with frozen shoulder, they can hardly move their shoulder, right? They have limited range of motion. This is something that they can form just over time. I think from postural stress a lot, it can form from working on a computer. If you've done repetitive overuse actions with your arm, it could be tennis, it could be swimming, maybe in the past or maybe now, it can certainly lead to it. So think about rotator cuff tendons. There's 4 main tendons in there that sometimes get out of balance. Some turn off, some are way more active, and that causes a frozen kind of sensation, right? You're just not able to move, and it's very painful to move. So what can be done? So first and foremost, to release those tendons, basically use a lacrosse ball. That's my favorite. You can lay on the floor, you can go up against the wall, but basically you're going to hit all the different areas where the rotator cuff tendons are. It's going to feel pretty stingy and very uncomfortable, but that's just the nature of it. So you're going to work in the back here, you're going to work in the front here where the pec is and the biceps tendon. So I would do that on a daily basis just for a couple minutes, and do that before you do these 2 exercises, okay? So that's number 1. So for this one, you can grab a broomstick. So say it's my right arm or my right shoulder that has the frozen shoulder. I'm gonna grab a broomstick. All I'm doing with the right hand is holding onto the broomstick. So obviously, if I have frozen shoulder, I'm unable to do this with my right arm. I just can't move it. We're trying to get more range of motion in the shoulder. So gripping this broomstick, you can do it either palm up or palm down. Usually palm up is easier on the shoulder. So I'm just gonna grab, with this left arm, I'm just gonna push this up as high as I can go. So with the right arm, I'm not trying to lift it at all. All I'm doing is holding on to this broomstick. Okay, the idea is to get more movement in the shoulder without having to use that right shoulder. So that's number 1. Number 2, another one you can do is getting a towel this way, putting it over your shoulder, and I'm gonna grip onto the towel with my hand down here to the right. Right, so if I'm to the side, you can see with my left hand, I'm just gonna pull up on the towel. The whole job of my right hand is just to hold on. I'm not trying to move it, right? So this is a major kind of a stuck range of motion for people with frozen shoulder. They can't do this, right? They can't do this. So we're trying to grab on this way and pull up, how it looks from the back. Here, just pull up as far as you can, right? So all of these are going to be a little uncomfortable to do. It's just the nature of frozen shoulder, but you work it, do that every day. Sometimes frozen shoulder patients coming in, we can get some pretty good relief in a couple weeks. Sometimes it's a couple months. It's a very peculiar type of condition. But I'm Dr. Tyler Hamel, your Kingwood chiropractor. If you have any questions about frozen shoulder or rotator cuff syndrome, impingement syndrome, put it in the chat box below. If you learned something about frozen shoulder, give us a thumbs up and share it with your friends. There's lots of people out there that, and you'll know, because when they try to move their shoulder, they can only move it about up here, or they're trying to compensate with muscles up here, and that causes a whole host of other problems. So again, Dr. Tyler Hamel, your Kingwood chiropractor. Thanks for watching the video.